Hello, my name is Jared Byer. I'm a health and wellness coach, and I would like to invite the town of Tonawanda Police to the Lose to Win Challenge. This challenge will take place over the next 12 weeks, and during the challenge, the top 2 female and male participants will strive to lose the most weight at a healthy rate. At the end of the challenge, the top 2 male and female participants will be awarded the grand prizes. The final winners will be determined by participation and percent weight loss. If you have any questions, feel free to email Mia at mia.vicario@lmhf.net. Best of luck. Attention active members, in order to earn credit towards LMHF Wellness Program Part 2, you must watch the video in its entirety and email Mia Vicario at mia.vicario@lmhf.net to receive wellness credit. Hi everyone, this is Jared Byer presenting today on cardiovascular health. So this is a PowerPoint presentation and discussion about ways to rate your cardiovascular system, but also ways to improve it. There's a bunch of different things to look at that you are in control of, and then there's other things that like age and so on and so forth that you really can't control. So this presentation is about improving your cardiovascular health, which is ultimately important. Your heart is the #1 organ in our body aside from our brain. It keeps everything going. So keeping that healthy and providing it with as much nutrition and exercise and rest that you can is very, very crucial. Okay, so obviously this is more about me. I've done a lot of videos for you guys, so it's not really a big thing, but I just want to explain what I've done. So for the past 28 years, I've been a health and wellness coach. I've done everything from pro athletes, kids, soccer moms, obviously corporate wellness. So this is kind of a summation of a lot of the information that I've gathered through my experience and education on ways that you can improve your cardiovascular system. So we're going to start off here by talking about heart disease facts. So basically, heart disease is one of the biggest issues in this country when it comes to overall health concerns. Heart disease is affecting so many millions and millions of people. My father, for instance, has been having a lot of heart problems. He's 70. His are more conduction issues with his heart. But there's a lot of things that we talk about when it comes to heart health. But the main thing is when it comes to the facts about heart disease, they are getting worse, right? There's more and more issues with people with heart disease, even at younger ages. So this is just some of the stats and information about heart disease. Every year around 715,000 Americans have a heart attack. And all these numbers are climbing, so every year we're going up. Our society is not getting healthier, we're actually getting a bit sicker, especially when it comes to chronic illness. People are not dying as quickly because of different interventions and whatnot, but they're not healthy, they're chronically ill. So these are some of the things here, some stats. So this heart disease is preventable. That is the one big thing to look at. A lot of people say, well, it's based on my genetics and my parents had this or that. There's really more to it than that. So these are just some more stats to look at when it comes to heart disease facts. We're going to look now at your cardiovascular system. So your cardiovascular is cardio is basically your heart, vascular are your blood vessels. So it's the combination of that system we're looking at here. So vascular is going to be the blood vessels, and it's your transport system for #1, nutrients and oxygen. Oxygen obviously being #1. But it's transporting these nutrients around your body. Now there's many different things to look at, which we'll discuss when it comes to blood flow, blood pressure, things like that. But the key to this is that your cardiovascular system is what's transporting nutrients from oxygen and nutrients to your cells, but it's also taking waste products out. Carbon dioxide is being passed through the lungs and passed out as we take air in. So just some stats and things like that about your cardiovascular system and how it works. But again, a lot of these things that we look at, every day we need to focus on things that are going to help keep our cardiovascular system strong. So obviously rest is a huge thing I've talked about in a lot of my videos, and making sure you're getting the proper amounts of rest. Our heart is constantly beating. Everyone eventually passes away from cardiac arrest where the heart just stops. So there's many ways we can bring that back with AEDs and things like that and modern technologies. But the main thing is we are pronounced dead when our heart stops. So our heart starts before we're even born, right? So in the womb, our heart is going. And we have a certain number of beats that basically would encompass our life. So we want to take care of the heart as much as we can because it is a muscle. It is the most important muscle in our body, and there's a lot to it. So we're going to discuss a bit more about that. So again, the heart itself is a pump. So it's a 4-chamber heart that we have. Your ventricles are basically the bigger parts of the heart where actually it's pumping it out either to your body or to your lungs. The atrium are actually pouring down into the ventricles. But the main thing is when you look at your left ventricle, which is the biggest part of your heart, that's what's going to pump blood out through your aorta and into the rest of your body. So that's the main component. So when we exercise and do things like that and strengthen our heart, that's actually the primary component, is the left ventricle, a big part of the heart. We're going to get that contraction and ejection of all that blood into our system. That's the key when it comes to actually developing your heart. So obviously we look at 2 things. We look at your resting heart rate and your max heart rate. So your max heart rate is typically determined to be 220 minus your age would be your typical max heart rate. So that's something you don't really want to get near when you're exercising. It's not like if you go over it, you're going to have some major problems. But when it comes to your max heart rate, that's kind of a level that we look at when we're trying to determine what levels of training you should be at or what intensity levels. So if your max heart rate and also